So next, I'd like to invite Lieutenant Colonel Nirmala here to speak about a unique interprofessional education program that we run in our hospital, MGM Healthcare Malar, which we call Karkandhu. Karkandhu in Tamil means learning together.
Lieutenant Colonel Nirmala Iyer has a vast experience in nursing leadership and has served in the Indian Army before moving on to civilian healthcare leadership roles. She has a BSc Chemistry, a BSc Nursing, Diploma in Midwifery and postgraduate diplomas in Medical Legal Systems and Hospital and Healthcare Administration. She has rose to the rank of Lieutenant Colonel in the Indian Army, recognizing the demanding nature of Army nursing, particularly in managing war casualties. She ventured into civilian healthcare and has held prominent roles as Director of Nursing at Jehangir Hospital, Pune, followed by Director of Nursing and Chief Nursing Officer at MGM Healthcare, Malar Adayar. Over to you, ma'am.
Good afternoon, one and all present here. It really gives me immense pleasure to talk about the interprofessional education Karkandhu at our MGM Malar. Yeah, as you all know, what is interprofessional nursing education? It's a collaborative learning between the nursing and other healthcare professionals. Its goal is to improve teamwork, communication, and patient care, recognized by WHO and major healthcare organizations. Why we need this? I'm sure each nurse present here will think this is a picture of me someday. So you got multiple work. A nurse goes to the ward, somebody comes around, patient's call bell rings, pharmacy standing with a supplies to be taken out, and a lot of things going on. So she has to do multitasking. Why nurses need IP, interprofessional education? Nursing is a major part of any healthcare setup. As all of us know, nursing is the youngest of profession with greatest responsibility. You go to any hospital, the major portion is nurses. Out of that, 60% will be youngest nurse because they leave. Nobody stays till they become old. So you find always younger nurses in the hospital. And they spend 24 hours, like is always said. And they are present during birth and death. When the baby is born, nurse is there to share the joy with the mother. Also when somebody is in a deathbed, the nurse who holds a hand and gives courage to a dying. That means very emotionally demanding and physically as well. Nurses need to collaborate with every department for patient care. You all know that when you go to the ward morning, doctor is late, the patient is asking why doctor has not come yet. You didn't get the linen, the nurse is asked why there's no linen. The housekeeping didn't clean the room, nurse is asked why the room is still dirty. Dietitian gives wrong diet, nurse is asked why the diet is wrong. So she has to face many departments and give an answer. So she has to do a collaborative care. What is the objective of IPE, interprofessional education? It provides holistic patient care through teamwork with doctors, pharmacists and therapists, etc. Enhances communication and care planning, reduces medical errors, improves patient safety and quality by clarifying roles and responsibilities, empower the nurses and healthcare professionals. It builds teamwork and respect among different healthcare professionals, ensures efficient, timely and smoother workflows, supports professional growth, leadership and advocacy skills, promotes a patient-centered approach with better health outcomes. This is the Karkandhu one episode of this photo I showed. And our experience, like how it started, Karkandhu started MGM Malar. At MGM Malar, it was IP initiative started with the birth of Karkandhu, means learning together. Karkal means learning, Vandru means together. So this is the Karkandhu. The name was very aptly given by Dr. Patta Radhakrishnan and Vidya Madam. I'd like thanks, hats off to them for choosing a very right name. The core idea behind this program is that when the healthcare professionals work together as a team, learning collaboratively becomes more effective. Hence, Karkandhu was launched on March 4th, and now it is almost 27 weeks old child, very healthy child. It is a brainchild of Dr. Patta Radhakrishna, Dr. Vidya Madam and the team. It is like a spark to flame. Now, what began as a small spark, the idea of involving consultants in training nurses, paramedics, junior doctors, has today grown into a remarkable journey of learning and sharing. We have every weekly session on Tuesdays. In fact, it is known as a happy hour. People look forward to this hour, but it's a happy learning. And it's mainly that we have a role play and realistic simulation model where the things are enacted. So it's like a child play. All category staff from the consultant, junior doctors to staff nurses, ward secretaries, paramedics, HK staff are involved in learning and teaching. Like anything starts with a norming, forming, storming and performing. Same goes with Karkandhu. Naming as Karkandhu aptly, like I said, learning together. And forming. Weekly schedules are formed by the team. And storming, there are a lot of brainstorming being done, like how the things are going to be there. Performing, finally ensuring the greatest performance and learning experience for the all. The most amazing aspect is this learning schedule is going without any interruption and has completed 27 weeks 2 weeks back. A small glimpse of Karkandhu.
This is one of the most realistic simulation experiences that I have had.
செய்யார்லேருந்து கால் பண்ணாங்க, ஒரு பேஷண்ட் லேபர் பெயினில் வராங்களா சிஸ்டர், 38 வீக்ஸ் சிஸ்டர், பிரேமி.
Brilliant show indeed. The whole labor ward, everybody would shout push, 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 right from Meenama to Brito to the whole lot of them. And Dr. Prabhakar will be standing outside and he'll say, the way you people are shouting, Andhra Maila Sabala delivery output.
The moment when you enter the room, starting from the head, so level of consciousness, temperature, lungs 2 things, saturation level and respiratory rate. Heart 2 things, pulse rate and the systolic blood pressure. Urine output, that's it, that's the muse.
So I think I forgot my important role as a GDA and the narrator.
I was impressed by 2 parts. One on the knowledge part. They have a thorough understanding of what muse is. In the way that they have understood is, it's a learning for us now. In the level carrying on the teach panano abdingiradhu. Second part is the execution part. Where level execution.
This time, not to be beaten by anyone else, Dr. Suman and team, they've planned a completely what you say in Hindi hatke Karkandhu.
நானா முடி தானா அந்த முடி வராமல் போனவங்க யாருமே கிடையாது. அதனால இந்த முடியெல்லாம் போயிடும், திரும்பி வரும்போது என்ன மாதிரி நல்ல ஸ்டைலாக முடி வந்துடும் சொல்லிடுச்சு.
Attention please, code red activated, 4th floor CTICU.
Shut down the power supply. Housekeeping, segregate the materials. Next, fire team, rescue the patient. Nursing supervisor, medical related documents and other things they will conduct. Please cut up the emergency.
So in a brain bleed, we need to reduce the BP. In a brain infarct, we need to have a higher BPs.
Day 2, day 3 of bleed, you 120 வச்சுக்கோங்க. Day 1 அப்படி massive 220 ல இருந்து 120 இருக்குன்னா it's very risky. It is precipitate ischemia.
நீ அப்படியே படுங்க, உங்களை ஷீட்டோட நான் எடுத்து உங்களை சேர்ல உட்கார வச்சிடும். சரிங்களா?
So I feel you have a very knowledgeable physiotherapy team here. I was really impressed. I have not seen such a learning activity in any of the hospitals I have visited.
The next highlight was the transfer of the patient. He's one of the cutest patient. Having dimples on both the sides, and it was really amazing to see how he is cooperating. Yeah, so it was really an awesome demonstration by the entire team. Fantastic. Thank you so much.
This is in short, Karkandhu. The key focus areas, the program's curriculum includes both clinical and non-clinical skills. We don't only teach clinical, we also go for non-clinical. Clinical skills examples are cardiac care, like management of patient with cardiac condition, you saw that, including STEMI management, maternal and child health, and gastroenterology topics, neurology topics, surgical process. Next, please. Next. Yeah, non-clinical topics like code red, like we have an enabage we call, like how do you manage a fire emergency. Also we enact on code pink, what do you do when baby abduction is taking place, code hazmat, spill management of blood and other material. Also we take, this was shown in the form of vision, mission, core values, where the employees really learn the meaning of all this. Usually what happens, vision is put on the board, it's only for reading when enabage comes. Nobody understands what is the meaning of it. Here they understand, so they enact, they use it during their daily lives. Methodology, simulation-based learning, team-based learning, role play. Each week, a relevant topic is chosen by the team. And like for example, if the myocardial infarction is a team, the entire cardiac team, right from the consultant, registrar, ER nurse, cath lab nurse, ICU nurse, technician, ward secretary, security, everybody is involved. Right from arrival of the patient in the emergency to financial counseling, shifting of the patient to a cath lab, procedure in the cath lab, going back to the ward. So the entire thing is enacted, so people understand everything in minute, in every micromanagement. So when thing comes, they are able to do better. There's a better understanding. Otherwise, ICU nurse only knows what happens when the patient comes to after the surgery. The ER nurse only knows what happens till the patient is shifted to the cath lab. Here it's not so. They understand the role of everybody. So with collaborative care will become the best care. The patient gets the best outcome. An outcome of Karkandhu, empowerment. So naturally, when you have more knowledge, you are more empowered. When you are more empowered, you are able to deliver better care. And happy learning. I think the best thing is when you're happy, you do the best, whatever you do. So when learning is happy, like it's like a child-like play. You're doing enacting. So it makes you feel like a child and you learn better. And enhanced problem solving, team setting, better leadership and confidence, critical thinking, prevention of medical errors and shared responsibility, enhances patient safety outcome, increase satisfaction for the staff. Prepare nurses and other healthcare personnel for real-world clinical collaboration. Otherwise, what happens? Medicine is not coming, you blame the pharmacy. Pharmacy is not giving properly. HK is not coming on time, so you blame them. Now you understand why there's a delay, why they're not able to perform up to your level, and you understand means you're able to perform, get the work done also better. And interpersonal professional nurse education is equal to better teamwork and better patient care. By focusing on these diverse areas, the Karkandhu initiative ensures that healthcare teams are well equipped to handle a variety of patient cases collaboratively and effectively. We celebrated 25th episode recently, 26th August. Dr. Tilaka was there. And there was a poster competition, also the feedback from the staff, expressing the views on Karkandhu, which are very positive and encouraging. This is a real testimony of the effectiveness of this initiative. The recording of these Karkandhu are available on the YouTube. You all can see it. You just type Karkandhu, you will get this recording, you can go through it. I think finally, together we learn, together we care, together we heal. I think teamwork is the best work. And team learning is the best learning, which Karkandhu proved. Thanks a lot for patient hearing.
Just want to add a little more to what she said. So in case any of you have not, when we see this, it's a little difficult to figure how is an interprofessional education happening, because that is not something that is commonplace for any of us. But please do go and watch the YouTube videos. The amount of effort that each and every member from the team, including the nurses, doctors, technicians, they include housekeeping, they include in literally everybody who is in the patient care area and who has to get involved in that particular scenario. So the kind of learning that comes out of it, the practicality that is in all of the sessions, the amount of role plays involved, the amount of immersion that is in all of these is extraordinary. So I would really recommend all of you to go back and see these YouTube videos. You will definitely find them very, very interesting.
It's good that it's been consistent for 25 weeks. Many times we start things like this and in 1 or 2 weeks it loses steam. But the best thing is it's been consistent and going strong. So really, congratulations to Dr. Patra and his team for maintaining the consistency and taking it forward.
May I request Purnima from CMC Vellore to felicitate Lieutenant Colonel Nirmala Iyer. Purnima, are you here? Yeah. So Radhakrishna, you want to say something meanwhile?
Karkandhu is a very sort of thing of happiness for Vidya and me and my entire team. Actually, the whole this seed is germinated by Dr. Tilaka. Till that time, we didn't have so much of an idea of what Karkandhu means, but then we could put it into practice and we saw how, what sort of happiness and what sort of learning that comes into it, because it all started with a couple of nurses coming to me and say, will you be teaching the sisters, will you take classes? Then I said, no, taking classes is not the thing, we have to do something differently, because meeting doctors and asking them, requesting them to take classes is not easy, because sometimes the doctors are busy, teaching nurses always becomes secondary to them. And when we started this movement, it just caught momentum, and now Tuesday, 1 o'clock, the whole thing shifts towards our auditorium where this thing happens, and all my team members, of course, Vidya is the one. If Pari is commenting on consistency, if you see marvelous medicine consistency, it's more than 5 years now. And consistency and she are synonyms.